video, I'd like to discuss healthcare policy in the United States, beginning with the cost of healthcare. So the cost of different healthcare, of course, depends on which type of healthcare you're getting, which type of plan, and other cases may arise. But one of the main things to think about when you're thinking about the cost of healthcare are health maintenance organizations. Basically, these are organizations in which people pay into. It's an organization which an employer or if you're looking for health insurance, you go to contract with, and you go in with this organization which will provide you health care. And inside the organization, there are a lot of doctors and other medical professionals which are in it, and those medical professionals help to provide health care. However, sometimes organizations will not allow people who want to see specialists or doctors outside of their organization to see them with the same coverage. That's something to keep in mind. Now, looking at access to healthcare, 1/3 of the public puts off getting care for their health because, well, the cost and the insurance that they don't have and things of the like. World War II really began the time of huge health insurance, as during World War II in the United States, raises couldn't be given to employees, so to entice employees, employers gave health insurance to their employees, and ever since then, health insurance has been a benefit of working. 55% of Americans get their health insurance from the workplace. However, there are some people who do not have health insurance. For example, the Children's Health Insurance Plan helps people who cannot afford health insurance, and that is around 72 million Americans. 15% of Americans do purchase insurance, but around 33 million people in 2014 did not have health insurance. That was around 4,800,000 children and 5,200,000 young adults. So moving from, who has health insurance, healthcare, and how does that look in the United States? What does the government do? The role of government in healthcare. So the United States does not have national health insurance like many other countries do. This was something proposed by Harry Truman. However, a lot of people at the time believed it was socialized medicine and things of that nature. But a national health insurance is basically when all the citizens of a country pay into a health insurance, and then they get out, health care from anyone in the nation that can provide it and that the government contracts with, because the government really controls the health care in that case. Medicare is something that was created in 1965 to provide ambulance or hospital transportation for elderly people, and also to provide cheaper access to healthcare for elderly people. Medicaid is something which is provided to people who are lower income, and that relates to healthcare. So anything that someone would need for healthcare reasons that they cannot afford, Medicaid can do that. However, it's a federal and state work on this, so sometimes states can give bonuses and sometimes they can take things away. So it really does vary from state to state in the United States when it comes to Medicaid and healthcare from Medicaid.